This was week 4 classwork, and I want to make sure I give you an opportunity to do this assignment because it's really going to help with your prep for exam 2. Okay. So, in the first, you're going to find this in week 4 classwork. It's the second item down. So, what strategies are involved in cancer prevention? You can find these answers on page 631. These are primary prevention methods, most of them. Yes, they are primary prevention methods. Screening, cancer screening is a secondary method of prevention. Okay, when it comes to cancer screening, it is secondary prevention, but we also, it's categorized in disease promotion, um, health promotion, and disease prevention. Sorry. So we're going to concentrate on breast and colorectal for this class. You need to know the test, but also the age and also the frequency of the test. So make sure you make that distinction. Um, for example, mammograms, annual if desired, but if for 40 to 44, 45 to 54 must do annually, and then greater than 55 every other year, right? Um, and then colorectal, usually around age 40. I mean, age 50 is when somebody gets their first colonoscopy, and then they get that every 10 years, but they could get it as young as 45. Fecal occult blood testing is an annual test that that people can have on their stool. Remember, we talked about that for the first exam, and that is highly tested, and it's attested in a lot of different proctors in ATI, fecal occult blood testing. So make sure you really know that inside and out, okay? Now, when we talk about radiation, there's two types, main types of radiation. There's brachytherapy. The word brachy means short, and therapy means therapy. So short radiation therapy, and this means inside the body. This is internal radiation. Whereas teletherapy is over a longer period of time. So they have this typically outpatient, it's also called external beam radiation. They get tattoos put on. You can find the answers to this little table in page 648. You really need to understand the interventions for both types of therapy, whether it's brachytherapy and teletherapy. And then the 7 warning signs of cancer, you find this in various places in the book. I kind of brought them all together with this mnemonic caution. So make sure you understand what the signs and symptoms of cancer are by using caution. This case study, if you have time to do it, you should do it with your study group because you learn a lot. But also make sure you review neutropenic, thrombocytopenic, and anemia that we studied for the first exam, because cancer treatment, both chemotherapy and radiation, can cause bone marrow suppression. So you can find the answers to that on page 644 to 645. Really important. You know that, or pull out your old worksheets for thrombocytopenia and anemia and neutropenia. You have to know neutropenia precautions, and that's similar to HIV, which is exactly what you're going to have to know for this exam. So you can kind of put them in the same category. You also need to know the nursing measures when patients have anorexia, nausea, and vomiting, which they can get from chemotherapy, but also radiation, depending on where the radiation is. So you need to know those interventions that are going to also help appetite. Nothing drives me crazy more than walking into a patient's room and seeing their food tray there and seeing several urinals filled with urine. So make sure you're channeling Florence Nightingale and you're cleaning up their rooms so that they feel comfortable and they feel like they have an appetite. And really, mouth care, which you wouldn't think, but mouth care plays a big deal in appetite and making them comfortable. People with that have had chemotherapy or radiation can have mucositis or stomatitis, so they can have irritation of their mucous membranes. So that, make sure you look up that too, because you can't give spicy foods. You have to serve the food cold or at room temperature. You don't want weird foods. Everything needs to be like very bland, soft, so that they can eat. All right, and then do these questions with your group, And then for the oncological emergencies, read about them on page 633 and try to determine what kind of oncological emergencies these three patients have, because you're going to need to know that for your exams, okay? So make sure you review that. Then we go into connective tissue diseases. So connective tissues, which are a lot of different kinds of tissue in the body, support our tissues and bind them together, okay? So when we talk about autoimmune connective tissue diseases, there are hereditary and there are autoimmune. So we're going to focus mainly on autoimmune connective tissue diseases, which rheumatoid arthritis, systemic lupus erythemus, and scleroderma occur because the body attacks its own connective tissue, okay? So because these are autoimmune connective tissue diseases, they have signs and symptoms that are similar in all conditions, and there are signs and symptoms that are more distinct just to one type of connective tissue. So when we talk about what's consistent with all these three conditions we're talking about, it's A all the way up to H. Okay, so A, B, C, D, E, F, G are all consistent with all those three autoimmune diseases we're talking about. Whereas H, the butterfly rash, you're going to see that in lupus. If the patient only has rashes on their skin, this is called discoid lupus. If they have A through G plus the rashes, then they have systemic lupus erythemus. Okay. If they have inflammation of their big toe joint, that is consistent with lupus, not lupus, gout. So gout is caused by uric acid forming and staying in the joint and creating havoc, usually after eating foods high in purines like shellfish and organ meats. I made one mistake. So C here is not common in all. It's common in rheumatoid arthritis. They get this rheumatoid nodule. So those are small nodule bumps that inhibit their movement. Okay, so you need to remember that too. All right, so when we get here, uric acid is seen with letter C. An increase in this substance is seen in gout. 2 is seen with letter D. This is a protein substance that's decreased in RA and SLE, so rheumatoid arthritis and lupus. Rheumatoid factor, you're going to see rheumatoid factor, you are going to see in E, which is present in clients with rheumatoid arthritis. And then 4 is A, so a decrease can be seen in chronic inflammation. 5 is F, so the ESR, that's kind of nondescript. The ESR, so it's elevated in all inflammatory diseases. The ANA, which is number 6, is positive in lupus, rheumatoid arthritis, and Raynaud's disease. And I wouldn't memorize that, but if you see ESR and ANA, I automatically think inflammation, C reactive protein as well. Number 7, creatinine, you'll see that in lupus because people with lupus can end up with renal disease. So they can have increased creatinines. 8 is G, C reactive protein is positive in rheumatoid arthritis and lupus. Again, I wouldn't memorize these. I would just know these are, the ESR, the ANA, and the C reactive protein means there's inflammation in the body because there's a lot of conditions that aren't even connective tissue diseases that these can be elevated in as well. Creatinine, when we're talking about connective tissue diseases, we really worry about people with lupus getting renal disease. Okay? All right, so we're going to match the symptoms with the disease. So morning stiffness of small joints in the hands and feet, hand down, that is rheumatoid arthritis. Okay, and then malar rash, no symptoms, that's discoid lupus. Hands turn cold and blanch when exposed to cold, that's Raynaud's disease, which can occur in all connective tissue diseases. Butterfly rash, fever, pain, joint pain, photosensitivity, that's SLE. Flare occurs after eating foods high in purine. That's go. Okay. All right. True or false? Clients with CT diseases or immunosuppressive diseases like HIV that we also talk about should take their temperature daily. That is absolutely true. They should take their temperature daily so that they can nip it in the bud if they start getting a temperature. I would answer these questions and see how you do. Um, Immune and infection conditions. Here are a bunch of quizzing you can do before your next exam. Okay, each one of these has quizzes in it, and there's a lot of questions, and I keep pushing this, but you have to spend a lot of time doing NCLEX questions. Every time you study, you should be doing knocking off 25, 30 questions, okay? Really important. That's the only way you're going to know if you understand the disease processes we're talking about. So I'm sorry we couldn't fit this in class, but happy to help you out with anything if you need it. You have the page numbers. You're going to unfortunately have to do the work, right? Because that's what the kinesthetic movement of just writing it out is going to help you on the exam. So I can't do that for you. So make sure you go to those page numbers, read through the book, um, and fill out this the activities to help on the exam.